Hey, everybody. My name is Lavadier Lee. Many of you might know me as VAD. I am the recruitment coordinator and community engagement specialist with the Black Men's Brain Health Research Study. I'm here with Dr. Robert Turner, the principal investigator of the R.W. Turner Research Lab. Dr. Turner, I wanted to ask you, what is Black men's brain health?
Well, so I'm glad you asked that. So the Black Men's Brain Health Study, which is what we're here about today, it's the first study of its kind that's ever been funded by the National Institute on Neurological Disorders and Stroke and co-funded by the National Institute on Aging. And it's the first one that's ever focused exclusively on the neurocognitive function of Black men. And in this particular study, basically what that means is we want to understand how Black men's brains age over time. We want to understand kind of the risk and resilience factors of Black men's brain health. And the two things that we want to really look at their exposure is what happens to your early life factors, say the environment that you grew up in, the neighborhood, parental income, all of those kinds of things that influence how our brains, develop over life. But then also a second group that we're looking at are Black men who played in some type of tackle football, whether that was American football, Canadian football, arena football, high school football. It doesn't matter. On any particular level, we're looking for 200 Black men, a group of 100 Black men aged 50 and above that never played contact football or contact sports, and a second group of 100 men that did play tackle football. So that's really the overarching goal of the study.
So you have 100 men that did play football and 100 men that did not play football, and you have to be 50 years and older, correct?
That is correct. Absolutely.
And so I'm out in the field. I'm recruiting people to be a part of this research study. Why is it important for our Black men to get involved?
Well, for a number of different reasons. One, as people may have heard, and you've said this before, we've shared it at our conferences, that Black Americans are almost 50% more likely, or let me say it this way, Black Americans are almost twice as likely to be diagnosed with Alzheimer's disease and dementia.
Wow.
And unfortunately, we are also diagnosed later in life, right? So we have a very high prevalence of Alzheimer's disease and related dementias in our community, but yet we are very sparse in terms of being involved in research. In fact, when you look at all the research participants that are involved with Alzheimer's disease and related research, Black Americans or Black people in America only represent 5% of all participants. But what's even more striking is that of that 5%, 75% are Black women, which means that only 25% is Black men, which is, if you look at the overall numbers, we only represent 1 to 2% of all people in these research studies. That also means that we don't know how the disease really functions with our population. We don't know how early we contracted, how it impacts us across our life course. We don't know how the drugs that they're developing, what they will mean for us. So really, it's very important that we understand Black men's brain health across the life course and what really are the risk and resilience factors to the way our brain develops.
Wow, thank you for that. Well, as you and I are both Black men, it sounds like we have a lot of work to do when it comes to this research. So once a person commits to being involved in the study, what happens next?
Well, the number one thing, and I'm glad you asked that question, the number one thing about this whole study is that everything is anonymous. We do not, when you decide to sign up, and first the thing that we do is we go through what's called an eligibility screening to see that you're eligible to participate. And then we give every person that does join the study a unique ID. And so we keep their own personal information, your phone number or your address, separate from any data that we collect. In fact, we only collect a phone number and address because we want to be able to compensate individuals for being involved in the study. We pay, I believe it's $250 compensation for everybody's in there. So all of the data that's in the study is completely anonymous. And so what happens is you get consented into the study, and then we do what we call the social determinants of health survey. So we ask a series of questions online with one of our research assistants in the study. And then once you finish that battery, then you'll be selected to travel to either Durham, down at Duke University, or go up to Boston University, which is when we will then do a series of neurocognitive examinations. We do blood draw, and then we also do MRIs, right? And as I mentioned to you before, even when all of that data is collected, even I don't know whose data is what. So it's anonymous, it's protected, and we make sure that your identity is really protected. So we fly you up, we pay for all your accommodations, your travel, your food, your lodging, and everything else like that. And we're really excited because we've had so many people that have shown interest in the study. But it's a big haul because the NIH has never funded a program where 200 Black men exclusively are in the study. And we have to prove to them that Black men care about their brain health.
Wow, that's amazing. So obviously, if you're 50 and up, if you're a Black man, you can participate in this study. As we close, what are the other ways? What are the other ways to support this study if you're not 50 and if you're not a Black man?
Okay, well, as we know, what we say very much in our community, there is no such thing as Black male health without Black women, right? Because we know that women make men go to the doctor. If you were leaving up to a man, they're not going to go into the doctor until our arm's going to fall off. We use the emergency room as our PCP, so to speak. So, you know, we want people to remember that, hey, your health is important. You do it for the women in your life, your daughters in your life, the men in your life. We have a directory, so, you know, you can join if you're 18 and over and you want to be involved with the Black Men's Brain Health Initiative, our directory. You can join in on that. You can go to our website, mensbrainhealth.org. You can see that. We have a number of other studies that we have involved with athlete brain health that people can get involved with. And truthfully, we even are starting an ambassadors program because we know that Alzheimer's disease and related dementia is going to hit our community really, really hard as people start to age, people start to become caregivers. So reach out to my website, which is rwturnerlab.com, and there's a number of ways that you can get involved with us.
Awesome. Well, Dr. Turner, thank you so much for your time, and thank you for doing this research. It's extremely meaningful to the Black community. Thank you.
Absolutely. Thanks for having me.